AdvancingMentalHealth.org, your place for information and resources for better outcomes.
Hello, and welcome to AdvancingMentalHealth.org's video channel. I'm Jeff Baker. Here at AdvancingMentalHealth.org, we are mental health advocates. We have only one interest, and that is better outcomes for people who suffer from mental and emotional distress. And in today's world of mental health, there are a lot of opportunities for better outcomes. This particular series is going to be on diagnosing mental distress. The audience is a general, broad audience. Some of you watching this are very savvy and know a lot of the terminology, others don't. I'll be defining things as we go and giving a little background so that everybody can understand what we're doing. I'd like to open with a little story. I was picking up my daughter from school one day. This was several years ago. She was 14 years old, and she got in the back seat of the car with her little girlfriend. And she had at the time a big crush on one of the boys, and she had gotten her feelings hurt that day. And she was very upset, and she was sad, and she kept talking about how depressed she felt and how depressing the situation is, and she went on and on about this. And the other little girl piped up and got my attention and said, "Oh, by the way, you don't have to worry about her depression. It's situational. It's not chemical." And I kind of laughed and I said, "Why, thank you for that reassurance." And here was a 14-year-old girl making a psychiatric diagnosis. And then I started to think, what made her feel that she had license to do that? And if my daughter was suffering from, say, a chest pain or a pain like in her solar plexus, and she had been uncomfortable all day long, and she was complaining in the car, I couldn't picture that other little girl saying, "Oh, listen, don't worry. It's indigestion. It's not congenital heart disease." So what we want to look at first is, how is mental distress diagnosed? Now, primarily, it's diagnosed using this book, which is called the Diagnostic and Statistical Manual of Mental Disorders, or the DSM. In the DSM is contained all the diagnoses for mental disorders. The book was created by the American Psychiatric Association. The first edition of the DSM was created in 1952, and the current edition is the 5th edition. In the current edition, there are over 300 different diagnoses for mental disorders. And what this book does is codify those mental disorders and also billing practices. And each mental disorder has a code next to it which is used to submit to insurance companies, and it helps to standardize the whole diagnostic process for mental disorders. Now, the next question is, how does a mental disorder get into the DSM? Now, when you go to the website of the American Psychiatric Association, and this is a web page on the DSM-5 development, and you can see here that there are various work groups, and each work group is specialized in a particular area of mental distress. ADHD and disruptive behavior disorders is the first one, and you can see down the list eating disorders, mood disorders, psychotic disorders. And when you click on one, like let's click on the mood disorders, you go down into the mood disorder work group, and you can see who's in that group. And you can notice that a lot of the psychiatrists and MDs are from academia. These are very well-known, generally experts in their field, They're involved in research, and they really are very competent in what they do. Now, when these experts get together as a work group, there are discussions based on their large amount of experience and expertise about various clusters of symptoms and behaviors that might qualify as mental disorders. If the group as a whole agrees any particular cluster of symptoms or behavior qualifies to be a mental disorder, it is then given a name and put into the DSM as a mental disorder. So what we really need to understand is that the 300 different diagnoses for various mental disorders that are in the DSM are created by consensus of experts and not any laboratory measure. Someone might wonder if in identifying these that the American Psychiatric Association might have big laboratories with people with white coats running around and beakers with smoke coming out of them and Bunsen burners underneath them looking for various scientific validation of these mental disorders. And that's not currently the way it works. Now, Dr. Thomas Insel, who is the current director of the National Institute of Mental Health, which is commonly referred to as NIMH. The National Institute of Mental Health is under the National Institute of Health. It's a government agency. He has served as the director since 2002. And the NIMH is the largest mental health research organization in the world. They have an annual budget of about $1.5 billion that they spend on research to create better treatments and try to find a cure for mental disorders. Now, Dr. Insel, in an article called Transforming Diagnosis, said this: unlike our definitions of ischemic heart disease. Ischemic is a word that means not enough blood. So ischemic heart disease is heart disease where the heart doesn't get enough blood. So unlike our definitions of ischemic heart disease, lymphoma, which is cancer, or AIDS, the DSM diagnoses are based on a consensus about clusters of clinical symptoms, not any objective laboratory measure, which is a validation of what I had discussed earlier with you. In the rest of medicine, he goes on to say, this would be equivalent to creating a diagnostic system based on the nature of chest pain or the quality of fever. Now, when diagnosing mental distress, generally speaking, when a psychiatrist makes a diagnosis, it's done solely based on these clusters of symptoms and or behaviors without testing for any other possible underlying causes. Symptoms like depression, anxiety, mood swings, hyperactivity, even delusions, paranoia, personality changes can have many underlying causes. For example, all of these symptoms can be caused by diseases, medical conditions, toxic exposures, drug reactions, both prescribed and illegal, nutritional deficits and excesses, physical trauma, both past and present, allergies of all sorts from food and environmental, life events and traumas. So there can be many, many underlying causes for various mental distress symptoms. Now let's take one, depression. Now this is a lot of people experience depression. Many times depression can be a symptom akin to pain. In other words, just part of the body's warning system that something isn't quite right. And you can see here that that can be in physical diseases and conditions, things like hypothyroidism, and you can look down this list of many, many different physical conditions and diseases and allergies and toxic exposures. And you can see and look up in any medical book or talk to any doctor, and you will see that everything on this list can in fact cause depression. In addition to everything on this list, you have depression being also a reaction to something. So for example, if somebody is being abused physically or bullying or stalking or emotional abuse, that can cause depression. Losses can cause depression. Lots of life difficulties and stress points can cause depression. Emotional trauma can cause depression. Now, a standard medical diagnosis, this is what is used throughout medicine, usually involves a known cause of the disease or symptom, a known physiology, and lab tests. Let me give you an example. Strep throat. Okay, now strep throat is caused by the Streptococcus bacteria. So it has a known cause. When somebody goes to the doctor looks at somebody's throat. If it's very red and there are white dots on there, that is a known physiology. And there's also lab tests. If the doctor sees that, he takes a swab. 10 minutes later, it's confirmed that you either have strep throat or you don't have strep throat. Now, having a known cause, known physiology, and lab tests is ideal, but not all diseases have those factors. When those factors are either not known or available, like, say, for example, no lab tests, tests are usually done to rule out other possible causes. Now, a perfect example of that is Alzheimer's disease. Because Alzheimer's disease currently has no known cause, and there are no lab tests that somebody can take to find out whether they have Alzheimer's. In other words, you can't have a lab test that says, oh yes, you're positive for Alzheimer's. That doesn't exist right now. That's not necessarily a bad thing, but when it's suspected that somebody has Alzheimer's, they're displaying those symptoms. Like most other areas within medicine, there is a comprehensive effort to rule out other diseases and conditions that produce those same symptoms so that there can be some certainty about the diagnosis. Now that would include a complete medical history, a complete physical exam, and then very exhaustive lab tests. This is a very comprehensive process that is standard in all areas of medicine when there is no known cause or lab tests and certain symptoms are presenting and there's no way to verify that those symptoms are caused by what's suspected. So extensive lab tests and medical procedures are done to rule out anything else that might cause the same symptoms. Now let's talk about diagnosing mental disorders. Now currently, mental disorders have no known cause, no known physiology, and no lab tests. And it is a scientific fact that many different underlying causes can produce the same symptoms as mental disorders. Yet, generally speaking, when a mental disorder is diagnosed, unlike the rest of medicine, no medical testing is done to rule out the many other underlying causes that can produce the exact same symptom. This would be like you going to a doctor with a chest pain and the doctor says, what kind of pain? And you say, well, it's a sharp pain, it comes and goes. And they say, well, you have heart disease and you need open heart surgery. And you might come to find out that you have a lung infection, or you just had horrible indigestion, or an ulcer. You're not going to know unless lab tests are done. We here at AdvancingMentalHealth.org advocate, number one, that all forms of mental distress initially be regarded as symptoms that could have many different underlying causes. And two, that mental health professionals stop operating in a vacuum and be accountable to employ the same standard diagnostic practices that the rest of the medical community is held to. If somebody is displaying symptoms of mental distress, a standard medical diagnosis would include first, medical testing, a full exam, medical history, lab testing for diseases, medical conditions, toxic exposures, nutritional issues, drug reactions, etc., or any physical trauma. After that, allergy testing for food, environmental, and other forms of allergies. After that, an examination of life situations that could cause the same sorts of symptoms. Discovering stress points, any abuse that's going on. For kids, trouble in school, losses, all challenging life situations, emotional traumas, or moral, ethical, or spiritual dilemmas. And then a mental health evaluation. What we advocate is science first. That when somebody is displaying symptoms of mental distress, apply the same standards as every other area of medicine. Thank you for watching, and stay tuned. We have many more of these video series planned. Thank you.